Bismillahirrahmanirrahim. Hello and welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. I hope all of you are well and fine. My name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. Dear friends, today I'm going to explain another lecture that is related to the hormone test and it is about the ACTH hormone test. So what is ACTH hormone test? What are the purpose? From where it can produce, what are the main causes of high and low ACTH, okay, what is the diagnostic purpose, what is the function, what is the normal range, how to perform this test, etc. So we are going to explain this ACTH hormone in detail. So if you guys remember, we already talked to different hormone tests, like we have talked FSH, LH, prolactin, thyroid hormones, and some other hormone as well. If you miss these videos lecture, hormone related video lecture, so I will recommend go back to my channel and watch the playlist of the hormone test. Then you will find that you will find all the video lecture related to the hormone test. So today I'm going to talk about that what is ACTH hormone test. So now let's start the video. Dear friends, first of all, let's see that what is ACTH. The full form of ACTH is adrenocorticotropic hormone. Okay, now it is the type of the hormone that is mostly produced from the anterior part of the pituitary gland. As all of you better know, the pituitary gland has two parts. One is anterior, other is the posterior. Okay, and all of you better know that this pituitary gland is located at the base of the brain. Okay, so this type of the hormone is mostly secreted from the anterior part of the pituitary gland. Now let's see that what is the function, why it produce, what is the function of this hormone. So the main function of this hormone is to activate it. So then what it will do, it will travel into the blood, reach to the kidney, and on the kidney there is another gland that is called as adrenal gland, from where it can produce hormones, like we can say cortisol hormones. This cortisol hormone is actually produced from the adrenal cortex when the adrenal cortex receptors receive the ACTH hormone. So remember what will happen when the cortisol hormone is released. So then it will perform their different function, because all of you better know when this hormone is this ACTH hormone is received by the receptor of cortisol by the adrenal cortex. So what will happen, the size of the adrenal gland will be a little bit large. Due to this way, cortisol hormone will secreted and it will perform different function, as I already explained. Means it can manage the stress conditions, because during stressful condition this hormone will be secreted and it will manage the stress condition. As well as it can also perform the other functions, like it can also modulate the immuno function, it can also maintain the inflammation process, and it can also regulate the metabolism process as well. So now this is the function of the ACTH hormone. Now let's see that why this test is recommended, why the doctor perform this test, what are the diagnostic purpose or diagnostic importance of this test. Remember friends, this test is mostly recommended during pregnancy. Dear viewers, the first purpose of this test is to diagnose the Cushing syndrome. As all of you better know that during the Cushing syndrome, what will happen, the ACTH level will high and it will produce large amount of the cortisol hormones. Okay. Second purpose is to diagnose or to monitor the Addison disease. Addison is a type of disease in which the cortisol hormone level get low. Next, it can also be used to differentiate between the primary and the secondary adrenal insufficiency. Primary adrenal insufficiency means the problem related with the adrenal gland. When the problem is related with the adrenal gland, we call it primary adrenal insufficiency. So when the problem is related to the pituitary gland, So it means that it is called a secondary adrenal insufficiency. Okay, so by performing this test, we will distinguish between the primary and secondary adrenal insufficiency. Next, this test is also used to confirm the function of the pituitary gland. Either the pituitary gland can perform their function properly or not. Moreover, this test is also used to check the level of the ACTH hormone into the blood. Their level, either their level is high or low. Remember, if their level get high, there will be the problem. If their level get low, there will be the problem. So their level will be normal into the blood. I will explain it later, that the normal range of this hormone level will be normal into the blood. Okay. Moreover, this test is also used to perform to check the treatment efficacy. Let's suppose if the level get high and there is a problem, so then the doctor recommends some type of the medicine. So after that, the doctor want to check that either the medicine is workable or not. So then the doctor also recommend this test. Or if the level get low, there will be the diseases. So then the doctor also recommend this test to just check either to just check the disease progression and to check the treatment efficacy, either the treatment is workable or not. So this is the importance of this test, that why this test is performed. So dear viewers, let's see that what is the test procedure. Mostly this test is performed on advanced analyzer machine, like advanced fully automated chemistry analyzer machines, like we have Mendre, Megalomi, Selectra. As you can see on your computer screen, these are the advanced analyzer machine. So we can perform this test mostly on this machine. We can also perform this test using semi-automated machine that are based on FIA, fluorescence amino assay. As you can see on your computer screen, these are the FIA based machine, like we have FindCare, Digrade, Bluefia. So these types of the machine are used for the test measurement their level into the blood. What will you do? First of all, you have to collect the blood into the gel tube or red top. Then you will centrifuge it to get the serum. Then you will run this serum on this advanced machine or onto the semi-automated machine. These are all about the test procedure. Now let's see the normal range. Suppose the normal range is actually varied. Okay. Now let's suppose if the patient come at morning time, especially at morning time, if the patient come, so at morning time their level will be a little bit increase at morning time, 10 to 60 picogram per ml at morning time, means 7 to 9 a.m. So their level will be 10 to 60 picogram per ml. At afternoon, when the doctor recommend this test at afternoon around 4 p.m., so then their normal range will be 5 to 30 picogram per ml. So this is the normal range of the test. Now let's see the main causes of high ACTH hormone. That when the level of ACTH hormone get high. So the first condition, that it is high due to the Cushing's disease or Cushing syndrome. Cushing disease, all of you better know that during this disease what will happen, there will be a benign tumor into the pituitary gland and it will secrete large amount of ACTH, and due to this way what will happen, cortisol hormone will be secreted and it will what it will do, it will gain the weight, means the body weight will be increases, there will be high blood pressure and there will be skin changes. This is all sign and symptom related to the Cushing syndrome. Second, their level will also get high due to ectopic ACTH syndrome. Now what is ectopic ACTH syndrome? It is actually the tumor outside the pituitary gland, like we have tumor in lungs, pancreas and tumor in the thymus. Next we have adrenal crisis or adrenal insufficiency. This may also increase the ACTH level, get high into the blood. Next we have the pituitary adenomas. It is actually the non-cancerous tumors of the pituitary gland that will increase the level of ACTH hormone. This will affect on the adrenal gland to secrete large amount of the cholesterol levels. Next we have chronic stress. So all of you better know, if there's a chronic stress situation, so what it will do, it will increase the level of ACTH hormone, and this will affect onto the extended periods into the females. Next we have congenital adrenal hyperplasia. So when the adrenal gland size get high, so it will secrete large amount of the ACTH hormone, or it will secrete actually the cortisol hormone, due to which the ACTH hormone will also get increased in a large amount into the blood. Next we have hypothalamic disorder. When there is hypothalamic disorder, what will happen, dear viewers? There will be a release of corticotropin releasing hormone. So when corticotropin releasing hormone will increase, so it will increase the level of ACTH into the blood. So dear viewer, this is all about the main causes of high ACTH level. Now let's see the main causes of low ACTH level. First is secondary adrenal insufficiency. The primary adrenal insufficiency will increase the level of ACTH, while the secondary adrenal insufficiency will decrease the level of ACTH hormone into the blood. And due to this way, what will happen? There will be a fatigue, there will be weight loss, there will be low blood pressure, okay, and all these are actually the sign of Addison disease, we can say like that. Next we have pituitary damages may also decrease the level of ACTH, pituitary tumor as well. Next we have long-term uses of corticosteroid medications. We have hypopituitarism. Hypopituitarism means when the pituitary gland secrete less amount of hormones. Moreover, we have adrenal gland tumor, or we can say adrenal hyperplasia. So it may also affect on to the ACTH hormone level. Primary adrenal insufficiency. So in this case, what will happen? The adrenal gland is failed to secrete large amount of the cortisol hormone. This will affect on the ACTH level to be get low into the blood. Next, dear viewers, we have Sheehan syndrome. Sheehan is actually the condition in which during childbirth, what will happen? There will be a large amount of the blood loss. And due to this way, what will happen? The pituitary gland will be damaged, and due to this way, ACTH hormone level will get low. So this condition is called as Sheehan syndrome. So in this case, the ACTH level will also be decreased. Okay, dear viewers. So dear viewers, this is all about the ACTH hormone. I hope you guys get idea about that. But if still you have question, you can write your question into comment. I will try my best to give you answer as soon as possible. If you like this video, make sure to hit the like button, share this video, and subscribe the channel to get more interesting videos like that. Thank you so much for watching.